As UK deaths from coronavirus top a grim milestone of 80,000, the quick rollout of coronavirus vaccinations cannot come soon enough for the UK. The UK has had 3.26 million cases of the virus so far, with 2.83 million of these being in England. While coronavirus rates are thankfully dropping in a number of areas across the UK, there is still a way to go until restrictions can be lifted. 3 million people have now been vaccinated, with hundreds of thousands now being vaccinated per day. Currently the top priority groups for vaccination are the over 80s, those in care homes and healthcare workers. There are currently 3 vaccinations approved for use in the UK, Pfizer/BioNTech, Oxford/AstraZeneca, and Moderna. We will use your email address only for sending you newsletters. Please see our privacy notice for details of your data protection rights. All of these vaccines are given in 2 doses, and you get good protection from the disease within 2 to 3 weeks of receiving your first dose. The second dose can be given any time between 3 and 12 weeks after the first. The second dose completes the course, and it is absolutely essential you get both doses, otherwise you will not be protected from the virus. Initially, their strategy for the Pfizer vaccine was to offer people the second dose 21 days after their initial jab, as full immunity starts 7 days after the second dose. According to the NHS, you must get a vaccine even if you've already had the virus. The advice reads, even if you've already had coronavirus, you could still get it again. The vaccine will reduce your risk of another infection and the seriousness of your symptoms if you do get it again. If you've recently tested positive for coronavirus, even if you have no symptoms, you should wait until 4 weeks after the date you were tested before getting the vaccine. The vaccine is your best protection against coronavirus. The government is aiming for every adult in the UK to be offered a vaccine by the autumn. Inoculations are being given to the most vulnerable first, as set out in a list of 9 high priority groups, which covers some 25 million people in the UK. These groups are thought to represent 90.99% of those at risk of dying from COVID-19. The current target is to have all over 70s and clinically extremely vulnerable vaccinated by mid-February.